Okay, so what this video is going to be about is the blood supply of the brain. And so the way I'm going to do it is just explaining what the circle of Willis is and try giving a quick way of trying to remember it, which is a little bit different to how you've probably been taught the circle of Willis. Then I will go over different cranial nuclei and where where the nuclei are and actually like giving a memory technique to help remember that as well. And then hopefully you can then link the circle of Willis and the cranial nuclei together to give you a bit of help when trying to understand how strokes work and what's affected in each of the different strokes in terms of looking at brainstem strokes. So you've probably seen this image before, which is a very confusing way of trying to understand the circle of Willis, but they all kind of have a similar idea, which is you've got this circle bit here, this bit here, here, and then stuff just branching all over the place. So I'm going to try going over it in a more simple way. So this is the most complicated way, or well, actually the most complicated way of seeing it on an actual brain. Then probably this bit, and then you have diagrams like this one. And so what this is just a kind of quick diagram way of trying to explain the circle of Willis. However, still very confusing. So we'll just go through it bit by bit and trying to decipher what's actually going on. Before we actually start that though, what is the circle of Willis? So the circle of Willis is just a way of supplying a blood supply to the brain through two different points. So that's here, which is the internal carotids, and then here, the vertebral artery. The reason why you have a dual blood supply to the brain is because the brain is obviously very important. So if one bit gets blocked, say you get some kind of blood, like some kind of problem at this point, blood can't travel here or here, so here. So actually it just goes all the way around and you can still get blood to wherever you need to go, which is actually a very important and very handy way. Because if you get a stroke, and a stroke is basically just when there's some kind of problem in terms of the blood supply of the brain, whether there's a blood clot, whether there's a bleed, that can lead to all kind of different problems. So the circle of Willis just provides an alternative route for the blood to go. So we'll go now over trying to understand it. However, before we start and before you start learning the circle of Willis, I think the really important thing to say is try getting as broad an overview as you can. Is when you look at something like this, it's going to be very confusing and it's going to make absolutely no sense because what you're used to is something like an artery going that way and then turning into a vein, and then it just goes back to the heart. So this obviously is not just one simple line and blood flows that way. It's quite confusing. So just take it bit by bit and just it's repetition, repetition, repetition when trying to learn anything in your anatomy. So yeah, let's just get on to trying to understand circle of Willis. So the way I'd try understanding circle of Willis is through the example of Will. Now Will, like anyone, is a person. So what makes up a person? So he's got his head, like that. He's also got his body, which goes like that. And then he's got his legs, which go like that. But the thing about Will is also he's got quite a strange body. And so we're just going to go through the different components of it. So we'll start from his feet upwards. So you've got his legs there, which are here. Then also attached to your legs, you've got your feet. So your feet go, well, Will's feet go like that. At the end of his feet, he's got toes, which go like that. Then the next strange thing about Will, and this is where it starts to get a bit more strange, is that he's got a tail. So his tail looks something like that. Then going up, the next thing that's strange about Will is his arms. So he's got arms that go kind of at this level, and then he's also got arms around here. Oh, there. He's got arms around there. So he's actually got 4 arms. That's already quite a strange thing about Will. As you probably know from your own body, you have these things called ribs, and they're kind of sticking out. So Will's also got ribs, and they kind of look something like that. Now, going above that, the thing about Will, he's aware of how he's slightly different to everybody else. So he tries to look smart to try making friends. So he also has a bow tie, and his bow tie is a bit like that. Now we'll move on to his head. Now his head is a bit strange. One of the strange things about his head is that he's got horns. So his horns look something like that. Let me just get rid of this bit. Yeah, so he's got horns basically. And another strange thing about Will is his ears. So his ears aren't like normal people's ears, they kind of look something like this. And another strange thing about Will is that he's got eyebrows, but his eyebrows are attached to his ears, and so they come off like this. Now, this is basically Will. As you can see, this already looks pretty similar to this diagram, just without all the labels. So, before we actually start trying to label and actually understand what's going on, what each of these lines mean, if you think of what a brain looks like, so if here's your brain, there, this is what we would call the cerebrum, which is a kind of what you think of when you look at a brain. That's the bit that you're looking at. You've also got this bit, which is kind of at the back here, which is called the cerebellum. And then you've got this bit here, like that, which is called the brainstem. So when looking at it, you'll already see kind of those similar words popping up. So if we go back to this, you have things like anterior cerebral artery, middle cerebral, posterior cerebral. That is all kind of referring to this bit here. Then you have things like cerebellar arteries, which are here. And then obviously spinal artery, which is obviously, you know where your spine is. So that would be lower down. Already, you can try figuring out general rules. So you know that if this bit is roughly called the cerebrum, that will be supplying the head, which makes sense. That's the bit where you think about with the brain, and that's the head. Now you got here, this bit, the cerebellum. You know the cerebellum's to do with balance and coordination. Well, what do we mainly think of with balance? We think of our limbs, our body, and that is kind of this bit. So that's all going to be having related to cerebellar artery, kind of like that. And it's the same with like the brainstem. So that kind of bit is supplied by the like cerebellar arteries. So that's just one of the main things to think about before starting. Just get that kind of overview in your head. Okay, so let's start labeling it now. So we'll start like before, start off with his legs and then work our way up. Let's go blue. So his legs, remember back on this diagram, I said that you've got the different supplies. So you've got here, which were the internal carotid arteries, and you've got these bits here, which are the vertebral arteries. So that's what the legs are. The legs are the vertebral arteries. I'm only going to label one side just to prevent it getting too messy. So that is the vertebral artery. And then obviously both sides. Now the next thing is that you've got kind of the body, which is here, and that is called the basilar artery. So I will label that here. Basilar artery kind of runs up the front of the brainstem, so like around the pons level. Yeah, and then you've got kind of the head. The head gets a little bit confusing, so we'll get to that later. So yeah, you've basically got here the body basilar, and then you've just got the legs as the vertebral arteries. Now let's go further into what each of these mean. So remember what I said before, that this kind of bit is all related to the cerebellum. So if you think about simple anatomical language, you're going to have different words like posterior, anterior, inferior, superior, all of these ones. And this comes very helpful. It's very helpful if you understand this when it comes to learning the circle of Willis. So if we just write on the side here what some of these words mean. So you've got superior here, and then you've got inferior. Like that. Now, the thing with the cerebellar arteries, which, like I said, is like the main body bit of Will, superior, leave it alone, it's fine. Inferior, however, divides into two. So if you've already got superior inferior divided, how can you divide it further? Well, you can divide it into anterior and posterior. And then you can start thinking of different names for that. So let's follow that same naming system. Okay, so let's start off with the inferior because that's a little bit confusing. So the inferior cerebellar arteries. You know that there's going to be a posterior inferior cerebellar artery, and there's going to be an anterior inferior cerebellar artery. So the posterior inferior cerebellar artery, also known as pica, is the foot. Pica. So posterior inferior cerebellar artery. So if that's the inferior and the posterior, where's the other inferior one? Well, the other inferior is the arm here. The anterior inferior cerebellar artery. So if we just put okay. So now we've got the two different inferior cerebellar arteries. You'll be hearing like pica and acre quite a lot. So just these are the main arteries. There will obviously be more branches off the circle of Willis. However, I'm just going to go over the main ones. And that should be okay for most of what you need to know and get like a basic understanding. Okay, so you've got pica and you've got acre. Then you've got the superior, and that's this other strange arm over here. Obviously, again, both sides. So this is the superior cerebellar artery. Now, what else is there? So what were the tail and the toes? So tail, toes, these obviously go together then, TT. Now, if we think about the thing about Will is that's a little bit, it's opposite. You'd normally think that the tail goes behind you and your toes go in front. However, for Will, it's switched. So this is called the anterior spinal artery. And then the toes are the posterior spinal arteries. Okay, so this is basically all of that. And then you've also got these ribs. So these here are called pontine arteries. These kind of hug the pons, if you think, so pontine, pons, that kind of level. So that gives a bit of an idea of what's going on and like what level that's at. If I just get rid of this. Okay, so just a quick overview then of roughly what's going on up until this point. Like I said before, all of this bit is related to balance. Balance is going to be related to, oh, I got rid of it, kind of cerebellum. So it's going to be called cerebellar arteries related to that. You've got the body, basilar. Then you've got the legs, vertebral. Off the legs, you've got feet, which is posterior inferior cerebellar artery, along with the posterior inferior cerebellar artery. If there's a posterior, there's going to be an anterior, which is here. And if there are two inferiors, then there's going to be a superior, which is here. Okay. Then you've got the other kind of spinal artery, so an anterior one here, and then you've got posterior as toes. And they're kind of switched around where posterior toes, but their toes normally go front and the tail normally goes back. But like I said before, Will has a weird body. Okay, so now let's go on to the head. So remember what I said before, which is the head is what you think of when you think of the brain. So this is all going to be kind of related to cerebral, like the cerebrum, which is like what you think of when you see a brain. So let's start labeling this now. Remember in terms of anatomical language, let's just go back to that again. Okay, so you've got things like posterior, middle, anterior, which I said before. So let's just write those out. Anterior, middle, and posterior. And it's kind of in that direction. So anterior at the top, posterior at the bottom. Now, the way to think about it is it just works up. And this is also kind of supplying the main bit of the brain. You also, again, see these arteries relating to, again, different types of strokes, and then we'll go kind of see what that looks a little bit like later. So, let's start with the posterior, and you know this relates to the cerebrum, so posterior cerebral artery. Let's go this. That's the bow tie. Posterior cerebral. Okay, then you've got the middle cerebral artery, and that is the ears. So remember I said the ears are a bit weird, so why did I call these the ears? Because middle, M, and then ears like music, so your music hearing, middle, kind of helps you maybe think about it that way. Middle cerebral. Okay, so then after the middle cerebral, you've got the anterior cerebral, and that's the horns. So the way I remember this, the anterior antlers, like on a deer, and they're the horns sticking out. Anterior cerebral. Okay, so that's basically kind of covers what's going on with that. If I just highlight what's going on, so here is the middle cerebral artery, that's the anterior cerebrals, and then here this bow tie is the posterior cerebral. Okay, so remember what I said before, you got the communicating arteries. How do you remember the communicating arteries, or how do you normally talk to a person? You talk with your head, right? You talk with your mouth, you talk with your ears. So that's all the communicating arteries are going to be at this kind of level. And the way to think about it, right, is that communicating, what are they communicating between? The cerebral arteries. So the posterior and the anterior communicating arteries, like the posterior communicating artery, communicates between the middle and posterior. So let's label that. That'll be here. The posterior communicating artery. What's the anterior communicating artery communicating between? Well, that's communicating between the anterior cerebral arteries. So that's this bit here. Anterior communicating. Okay, so if we highlight that bit, anterior, posterior. Great. Okay, what else did I say about Will? Well, I said that he's got his eyebrows coming off, right? So his eyebrows were here. Why did I say eyebrows? Because this is the ophthalmic artery. Eyebrow, eye, kind of relate to that. So this is obviously quite important. You can probably realize that this is something related to eyes. As again, yeah, a very important artery. But you can see that it's branching off of something else. And what do I say the two supplies of the circle of Willis, i.e. the starting points for the circle of Willis, are? This one here and these ones here. So the vertebral artery and this one is called the internal carotid artery. Internal carotid artery. In terms of getting the difference between internal and external carotid artery, as a general rule, where I remember it is the internal carotid artery does the inside stuff, so i.e. the brain. External carotid artery, that's the external stuff, so that's what you think of with head and neck anatomy. So that's going to be supplying things like facial muscles and things like that. That's, yeah, again, just a general rule to remember and makes it a little bit easier in understanding what's going on. So this is basically the circle of Willis. Now, yeah, okay, you will be having like other kinds of branches and stuff. So, for example, you'll see probably a branch there, which is like the internal acoustic artery, or some branches kind of coming off of the middle cerebral, like the lenticular striate arteries. Something like lenticular striate arteries, it's a place where it's like the blood supply is quite weak, so it's easy to get strokes there. Yeah, like you'll be kind of coming across different things. However, just going over like a really brief overview again, head, so cerebral, that is all kind of the head bit. Body, cerebella, this is going to be the cerebellum and the brainstem being supplied. So hopefully that all makes sense. Let's go on to this image now. This will kind of explain the blood supply of the head here. So when I said you've got the anterior, middle, and posterior cerebral arteries, and they supply the cerebrum, this image here is what I mean. So you can see on the key that this yellow bit is the anterior, this red bit is the middle, and this blue bit is the posterior. So this is kind of, again, general rules. The middle cerebral is the easiest one to think about. If you put your hands on your head as though you've made a mistake, you go, oh man, man, middle, you made a mistake. That's where you're putting your hands on your head there. That's basically where the middle cerebral artery supplies. So if you've got a middle cerebral artery stroke, it's going to be kind of affecting the structures in those areas. And so in terms of knowing which structures, the ways to remember that is by looking at a picture of the homunculus in the brain. That will kind of show you what structures, whether it's like the arms, whether it's the legs, whether it's the face. That tells you in terms of when looking at the symptoms of a patient that's had a stroke, you can tell which artery's been affected. And then the other thing to know is whether Broca's area, if their speech has been affected, Broca's area is normally on the left side of the brain. So if they've got a left middle cerebral artery stroke, then Broca's area might be affected. Their speech won't be affected. But if it's a right middle cerebral artery stroke, because Broca is only one-sided, they're not going to have well, it's unlikely that they're going to have speech problems. And again, remembering that things are contralateral. So if you've got a right-sided middle cerebral artery stroke, left side of the body is what's going to show the symptoms. Okay, hopefully that makes sense. Then you've got the anterior cerebral artery. This is kind of supplies the inside of the brain. So this is going to be a really bad drawing. But as you can see, so okay, that's your brain. If you cut in a sagittal plane, which is kind of sagittal, archer, so Sagittarius, and then cutting the body and the brain down in that direction. So this is all like a blade and you're cutting it down that way, and you're looking at the inside of the brain. And that part will be supplied by the anterior cerebral artery. Then you've got the posterior cerebral artery. That's like the back. So if you, for example, if there's a stroke in your posterior cerebral artery, something like your vision will be affected, because you've got your occipital lobe, which is there. Okay, so that's just a brief overview of the cerebral arteries and those types of strokes. Best place is literally just kind of keep practicing, give yourself questions with it. Okay, so the next thing I want to go over is the different cranial nuclei. So here, you've probably seen a picture like this, which is trying to show you where each of the different cranial nuclei are. It's a little bit confusing, so hopefully we can start kind of making sense of what's going on here. Okay, so I'll draw it out again. Okay, so you've got here, you've got the different, this is basically the brainstem. So you've got here, midbrain, pons, and medulla. It's like an M sandwich, so MPM, that's the way I remember it. And to tell the difference between midbrain and medulla, midbrain is close to the main bit of the brain, or what you think of the brain, which is why it's called midbrain. But yeah, okay. So if I just draw a midline, like that, this is now going to be the middle bit, and this bit is all kind of lateral. So the way to know where the different cranial nuclei are is by the rule of whether or not the cranial nuclei number is a factor of 12. So let's just write that down. What I mean by that is, does the number go into 12? So you've got 12 different cranial nuclei, 1 to 12. Let's just ignore 1 and 2 because they're slightly different. But yeah, this is where, and when people say that cranial nerves originate from the brain stem, this is what they mean. The vast majority of the cranial nuclei are in the brain stem. So let's just follow this rule down then. So ignoring 1 and 2, the next one along is 3. So 3, well, does that go into 12? Yeah, 3 times 4 is 12. So let's get that here. 3. Okay, does 4 go into 12? Yeah, 4 goes into 12. So that's there. 4. 5 goes into 12. No, it doesn't. So let's put that there. The other thing to know about with cranial nerves is that it just works their way down the brainstem, which makes it a bit easier. Okay, so 5. Does 6 go into 12? Yeah, it does. So that's in the midline. Does 7 go into 12? No, it doesn't. I'm just going to draw 7 up here for now. Yeah, 7 there. 8 go into 12? No, it doesn't. Does 9 go into 12? No, it doesn't. 10 go in? Does 10 go into 12? No, it doesn't. Does 11 go into 12? No, it doesn't. Does 12 go into 12? Yeah, it does. So 12 like that. Okay, so that is how you know basically where the different nuclei are. Now, what's the different, the blood supply of them? Okay, so remember what I said with kind of this bit is all the head, and then this bit is all kind of the brainstem related. And that's basically what's happening. So you're only going to be thinking from this kind of level down. You're not going to be thinking too much about the head. However, the difference, do you need to know posterior cerebral artery? That is here. So PCA supplies 3 and 4. The next one, so 5, 6, 7, 8. So if you just go with 6, 6 is supplied by a bacilla. The thing about the bacilla is that you can get this thing called locked-in syndrome. Locked-in syndrome then affects the basilar artery. Basilar artery supplies the 6th cranial nerve, which is the abducens nerve. What does the abducens nerve do? It does eye movement because LR6, SO4, all other 3. LR6, so lateral rectus, i.e. being able to look outwards. If that's not working, then that means you're not going to be able to look kind of in a horizontal plane. So that's why somebody with locked-in syndrome, such as Tony Nicholson, he had locked-in syndrome, and that meant that he was only able to look up and down, and that's how he communicated with people. The other thing with locked-in syndrome is that it can, so it's a basilar artery, and 6th cranial nerve is affected. So next thing is 5, 7, and 8. This is all ACA, so the anterior inferior cerebellar artery. That's supplied by that. Then we go 9, 10, and 11. That if ACA is for those 3, then PICA will be for these ones. And then you've got 12. What's 12 supplied by? The anterior spinal artery. Okay. So yeah. And then that basically explains that. However, the difference is that with 5, 8, 9, and 10, these ones, you get a little bit of crossover. So sometimes a bit of ACA can supply 9 and 10, sometimes a bit of PICA, 5 and 8. Gets a little bit confusing. But yeah, so that's basically how that works. One of the other things you might notice is that these ones, 9, 10, and 11, are all kind of knit together. If you actually look at a brain, they're not going to be, the different nuclei aren't just going to be distinct dots. It's going to be kind of mixed together. It's going to be a little bit ambiguous. So these 3 are called nucleus ambiguous. Yeah, and so that's basically that's basically the cranial nuclei. Just kind of going through what might happen. So you might have a berry aneurysm at the anterior communicating artery, which is this one here. And then if you look at something like posterior cerebellar artery, you can get something called Weber's syndrome. So that's an ipsilateral third nerve palsy. And why is that going to happen? Because you've got third nerve being supplied by the posterior cerebral artery. Then you can get something like the lacunar infarct, which is the lenticular striate arteries. That's the bit where I say they kind of come off the middle cerebral. So that's here. Then you're going to have locked in, which I said was basilar artery. Then you can get the vertebral artery stroke. So that can be affecting, for example, like say it's the anterior spinal artery affecting the 12th nerve, which is the hypoglossal nerve. Glossal means tongue, so this is the cranial nerve that controls your tongue. So your tongue will stick out and it will deviate to the side of the lesion. So if it's sticking out to the right, then you've got some kind of problem with your right anterior spinal artery. Then that can also then affect like the corticospinal tracts. Then you've got a pica stroke here, that can lead to lateral medullary syndrome, so that can lead to Horner's. And then you can also get medial medullary syndrome with spinal arteries. And then with ACA, you can get lateral pontine syndrome as well. So hopefully that kind of explains a bit about what's going on with circle of Willis and the cranial nuclei.